Got everybody?
So we got 2 minutes.
So we did.
Let's call the meeting to order of the Kent Hardin General Health District Advisory Council. You got a roll call?
Yeah, we got more than enough for
Okay.
quorum.
So, welcome tonight to our meeting. I'd like to thank everyone for taking the time to come. If you wish to speak, would you raise your hand and then say who you are? So when she takes a minute, she knows who it is. So at this time, do we need the election of secretary? We're opening for nominations of secretary. And right now it is Daryl, so.
I nominate Daryl Flowers for reading or update.
I'll second that motion. Christopher Williams, Cessna Township.
We have a motion and a second. Any other nominations? Any other nominations? Are there any other nominations? Let's move, somebody move to close nominations.
I'll move to close nominations for Christopher Williams, Cessna Township.
Second it.
Second, Al Bear, good stuff.
All
You
in
guys
favor?
don't vote over here, sorry.
All in favor, say aye.
Aye.
Opposed?
Kevin, can't you say, Valerie, who was the second?
Who seconded it?
Frank Sellers. Frank
Yeah.
Jackson Township.
So Daryl's been elected as secretary. Now we open the floor of nominations for election of chairman.
I make a motion, we keep Kevin Ridgway as our chairman, Christopher Williams, Cessna Township.
Do we have a second?
Second, Jamie Hall, Ada.
Are there any other nominations? Are there any other nominations? Are there any other nominations? Do we have a motion to close nominations?
I move we close nominations. Earl Rogers, Dudek, Pleasant Township.
We have a second?
Second, Cody Morris, Pleasant Township.
All in favor, say aye. Opposed? Now we're gonna read the minutes of the last meeting.
So we'll have 2 minutes. This is the meeting of the District Health Board, and then we had a special meeting that elected Jordan to the Health Board, so we need approval on both of them. Secretary Daryl Flowers did the roll call and went over the March 1, 23 minutes. Chairman, Kevin Ridgway asked if there was any additions, corrections to the minutes. Corrections were made the year of the budget to read 2024 instead of 2023. Chairman, Mr. Ridgway, called for nominations for secretary. Mr. Christopher Meehan nominated Mr. Daryl Flowers. Mr. Ralph Sherman seconded the nomination. Mr. Christopher Meehan moved to close the nomination. Mr. Randy Sharp seconded the motion. Mr. Daryl Flowers elected secretary by majority vote. Nominations for chairman were called. Mr. Christopher Meehan nominated Mr. Kevin Ridgway as chairman. Mr. Randy Sharp seconded the nomination. Mr. Christopher Meehan moved to close the nomination. Ms. Burl Rogers Dudak seconded the nomination, motion. Mr. Kevin Ridgway was elected chairman by majority vote. Chairman, Mr. Kevin Ridgway asked for the Kenton Health Department staff and health board members in attendance to introduce themselves. Mr. Kevin Ridgway has stated that there was one board member up for approval this year. Dr. Jessica Hinson was agreed to serve on the board member for another term. Mr. Ralph Sherman moved to appoint Ms. Jessica Henson as board member. Mr. Randy Sharp seconded the motion. Motion was carried by majority vote. Chairman Ridgway asked if there was any questions or comments about the annual report. President. presented. There were no questions. Mr. Kirby Rollins. The annual report showed that there was done by the health department during 2023. Chairman Ridgway presented the 2025 budget for the health department, and that's if there was any questions or comments about the budget. There were some questions and suggested by Ms. Dion Staley to consider and include next year's report. After brief discussion, no matters of ways to continue to cut costs, employee turnover and programs that were ended, a motion was made by Mr. Ralph Sherman to accept the 2025 budget. Mr. Christopher May second. Motion was carried by majority vote. Chairman Ridgway presented the contract for the union of the City Health District with the General Health District for approval. The motion was made by Mr. Dan Marshman to approve the contract between the City of Kenton and the Kenton Hardin General Health District. Mr. Ralph Sherman seconded the motion. Motion was carried. Chairman Ridgway presented Hardin County District Development Council bylaws for their approval. A motion was made by Mr. Jamie Hall to approve the bylaws of the Hardin County District Advisory Council. Mr. Ralph Sherman seconded the motion. Motion was carried by majority vote. Board of Health Vice President Ms. Marty Gray stated that there were no employees that had met a milestone anniversary in 23. Ms. Marty Gray then presented the Board of Health Annual Award for Employee of the Year, Ms. Dion Staley, who is the fiscal officer for the health department, the health commissioner. Mr. Kevin Rollins was asking for what his initial thoughts were being newly hired for the health department. Mr. Rollins mentioned employee turnover, people program consistency, grants missed out on because they had not having a full-time health commissioner for some time. There being no further business, Chairman Ridgway declared the 2024 meeting adjourned. Ridgway set the next meeting for March 12, 2025. Do that, or do the next one?
Yeah. Any additions or corrections on those minutes? If not, we'll stand approved as read.
Kevin Ridgway opened a special meeting on August 21st, 2024 for two purposes. A new agreement between the City of Kenton and the District Health Board to elect one new board member to the Health Board. Randy Sharp moved to form an executive committee, seconded by Ralph Sherman. Motion passed. Jerry Brose was nominated by Randy Sharp to present the village, seconded by Howard Lyle. Motion passed. Randy Sharp was nominated by Howard Lyle to the executive committee, seconded by Mike Howard. Motion passed. Randy Sharp moved to accept the agreement between the City and District Health Advisory Board and the City of Kenton, seconded by Fred Rush. Motion was approved. Jordan Temple was nominated by Fred Rush and seconded by Jerry Brose. Motion passed. Randy Sharp moved to adjourn, seconded by Jerry Brose. Motion passed. So, to explain the executive committee, if there's not enough for a quorum, we have to nominate an executive committee. We have 30 days to carry out that duty, which we just go ahead and go into the meeting, so we don't have to call another meeting. Has to have a commissioner, has to have a representative from the village, has to have a representative from the townships, has to have the secretary and chairman, and those are the ones that you absolutely have to have. So you meet that criteria by having an executive committee.
Was any additions or corrections on that? Not, no stand approved as read. Can we have the introduction of the board members? If you could stand and just introduce yourself, and then the employees too, if we have some.
Sure.
I'm Marty Gray. I am the president of the health board.
I'm Gerald and I'm a member of the health board.
I'm Jordan Temple, newly appointed member to the health board.
And I'm
Staley, interim health commissioner, fiscal officer.
Jen Newland, I'm the vital statistics registrar, clerk, and medical biller.
Thank you. At this time, we have one board appointment we have to fill, and, it's Roger Creech, and he's agreed to do it again, so I guess we need a nomination to approve Roger. Anybody wants to nominate?
So moved.
Do we have a second?
Second. Randy.
Chris and Randy.
Chris and all in favor, say aye.
Aye.
Opposed? Thank you. Has everybody looked at the annual report? I have questions, we have, well, hopefully we got answers for you.
To do some little clarification, if you look on the back of your agenda, there was some falsehood that I've heard different state, I will hope to clear up some of the falsehoods that I've heard, it's on the back of your agenda. Also, for this is the revised code, 3709.03, third paragraph down. The council shall meet annually in March at a place determined by the chair and the health commissioner for the purpose of electing the chair and secretary, making necessary appointments to the health board, receive and consider the annual report or special reports from the Board of Health, and making recommendations to the Board of Health or to the Department of Health in regards to matters for the betterment of the health and sanitation within the district for the needed legislation. The Secretary of the Council shall notify the District Health Commissioner and Director of Health of the proceedings of such meeting. So, we don't get to vote on the, budget. You do.
Recommend it.
We do recommend it. The Budget Commission is the only one that can make adjustments to the, budget, which is the prosecutor, the treasurer, and the auditor. So I even got a clarification from the auditor, prosecutor's office to make sure I was reading that correctly, so everybody's on the same page.
So everybody got the annual report? Any questions? You've looked at any questions? Jordan, you wanna say anything, or, so, right now, it looks like we're going for a 30% increase, right? Correct. And that is what they're asking for, I believe that is to cover a health director, am I right on that?
It's a director of nursing.
Right, director of nursing, yeah.
It's a director of nursing position. We have not been able to fill our director of nursing position. And, we've had multiple nurses in and out of that position. Unfortunately, or whatever, we are competing against every other county. And you guys know this. When you are competing against every other county, they're looking at the salary. And, we've not been able to retain it because we have been relying on grants. Grant money was great during COVID. It was great during the public health emergency. That has gone away. That money is gone, basically. And so, honestly, we would, if we had asked for a 5%, addition on every year, we would be at more than 30%. But we're asking for 30% from the various townships and the municipalities because we're behind the 8 wire. We've lost over half of our staff We went from a fully, what did we go from?
Was it 14, Dion?
14 staff, 13 staff to 6. And so, you know, right now, what we're doing is bare bones. We're able to do sanitarian, you know, approvals, but we can't do anything that brings in money at all. And, you know, so I don't know what else to say.
And Ohio Department of Health says we have to have a director of nurses.
Correct.
To be.
Yes, right, to be eligible for FEP grants, which
And
is.
other grants.
And other grants, right, but the big one is the FEP grant, which is the, Public Health Emergency Management Grant. And that brings us in, this year, it brought in $92,000. Okay,
The 92 is.
Oh, right. 65 came from the grant. So, you know, I don't know what else to say, that's
Are we
just
still
what-
actively looking for grants and?
Yes, but we can't really be approved for a grant without a director of nursing.
Does that have to be a full-time position?
It does have to be a full-time position per the Ohio Revised Code.
And we did find out that it doesn't have to be a bachelor's degree nurse. It could
Right.
be an associate degree nurse, which opens the field up a little.
Really up.
So, we have had nurses that have the interest.
Right.
But some of them say, no, that's not enough money.
Right.
One is stayed with us, and, you know, financially, we can't afford to hire a nurse, a director of nurses.
What's that cost? What's the going rate?
Well, for us, it would be about $30 an hour.
$30 an hour, $30 to $32 an hour.
Is it required a set number of hours that they participate, or is it 40 hours a week? Or
No, it's not.
to sign off?
So what we have declared as full-time is 36 hours a week, right?
Is that 71, is that right?
71 at pay.
Per pay period, which is 2 weeks. So yeah, no, it's not 40 hours a week. But, you know, we've had unfunded mandates, we've had a federally qualified health community health partners that has come in. It's taken a lot of our programs away. It's taken our dental out. It's taken, you know, we've lost Help Me Grow. We've lost a lot by missing nursing. And, you know, we were able to recruit a physician who would be willing to cover vaccines, but, you know, he can't give vaccines without somebody to give vaccines. And we don't have anybody who
Of
can
the
give
30%
vaccines.
increase, how much of this is budgeted for the director of nursing?
That, I don't know. How much is that?
I mean, the majority of that would be for the director of nursing on everyone's handout that they got for the 5-year projection. There's budgeted in for 2025 for a director of nursing for 6 months out of the year, and then all of 2026 on.
So how much is it a year for that director of nursing position in the budget?
I think she was at, with benefits and everything, right around $85,000.
$85,000.
Yeah.
And then if this was to take effect at 30%, that would be 2026, right?
Correct.
Correct, yes.
And how does that become effective? What has to happen for that to say, okay, villages are going to pay the 30% increase? Is that a vote by, or is that a resolution by, or what happens?
So that goes to the budget committee and.
The budget.
Budget commissioner.
Yes, the treasurer, the auditor, and the prosecutor. Those are the ones that have the authority to yea or nay the adjustment.
So,
And that'll come to us as a form of a resolution by the commissioners, or?
No.
You know, we're EMA, we're assessed by population.
I don't know how the villages are, but the townships is just deducted before we get the check.
Yeah.
Comes out of our inside millage.
So, Robin Jones, City Council. So if the programs that have been taken away because we didn't have a director of nursing, helped me grow. I know Health Partners Community Health Center does the Wildcat Clinic at the school, so.
They do all of the schools.
Right, so since those programs have taken over these programs and they're established now, do you feel like that's gonna be enough return for you to come back to justify that salary?
Yeah, that's the question.
So there are other programs that we can get reimbursed that the nursing can do, and one of those is, CMH, which is Children with Medical Handicaps.
It used to be BCMH.
Yeah, and so a nurse, it has to be a nurse that, keeps track of all those kids, right? The last I knew, we had 162 kids that qualified for the CMH. That meant phone calls, visiting them in their homes just to see how they're doing, and then after all that, they'd put everything in the computer for the Higher Department of Health. There are, if we ever can get back into doing vaccinations, which that's been dwindling
Yeah.
considerably because.
So were the vaccination clinics successful that they had? Did you
No,
have a
from-
turnout? Like,
No, from Logan County?
Logan County?
No one showed up.
No one showed up. So did that cost us to do that?
No.
Okay,
No.
thank you.
And we're not buying vaccinations, however, the vaccinations we give kids are free from the state.
Right.
So we didn't have to pay for those, but we do have some private vaccines that we bought in the past.
Okay.
But there's other, like, what was Simon Kent wanted us to help them with? Some program that they wanted us, the nurse to go into the home to visit kids that they had in their system. And it had to be a nurse, and they didn't have anyone that could do that. So that was a program we haven't been able to be a part of either by not having a nurse. There's
TB cases,
TB
we
cases,
had 3 that we acquired from other counties.
which there has to be someone go and watch them take their medicine on a daily, Monday through Friday. And that lasts for 130 visits. That means, someone has to go do that. And then they have to come back and enter everything into to the High Department of Health, ODRS. There's also the nurse has to check the ODRS every day to check on the communicable diseases that are in our county and follow up with those. There are some programs that are available that Dr. Newhouser's been agreed to help us with, and one is for STD testing and medications. He would order that, which is billable. And the CMH is billable too. I mean, we get money back from that. So.
Question?
Yes, first of all, are we supposed to raise our hand and say our name, or?
Yes,
Is this just-
please. Yeah.
Okay.
So they can write in a minute. So.
Thanks. Okay, Ron Rogers, Pleasant Township. My first question is, how much have you cut from this budget?
All of the positions that we've lost. I mean, we've lost.
How much money is that? How many programs have you cut?
How many programs have you lost?
We've lost
All of nursing.
all of nursing, yeah. All of the vaccine clinics, all of the.
And how many of these are duplicated now at other places?
They're duplicated at the federally qualified health.
Vaccinations.
Yeah, health
So
district.
there is duplication.
Right.
And we're not for sure on cost as far as what we lost yet.
Correct.
And how about exit interviews? Because I spoke to some of the past employees, and it wasn't because of the money that they left. Do you have exit interviews that we could look at?
We do not.
And then I noticed in the statement here, there's a 13% increase every year for the director for nursing. I mean, our townships, we don't have very much money. 30% is huge for us.
Right.
You know, we have to keep looking at our budgets. We have to keep severely cutting and cutting and cutting. And we're looking at this, and we're thinking, you guys are sitting really good. You know, if you do some adjusting here and there, and to, you know, and look at, if you did a lot less really well, and maybe build up the trust of the community, not that you've lost it or anything, I'm just saying that, you know, you build it up, and then I think you'll be more willing to pay more later, but you gotta do what you're doing really well first, I think, before any of us can justify 30%. Because I'm telling you, the population, Pleasant Township residents right now, we talk to our funeral homes and they're like, it takes us forever to get a death certificate. You know,
You got an employee here, is that true, Mark?
yeah, I mean, you know,
That's.
there's a lot of things we've got other people call and they're like, well, there's nobody sitting at the desk when we go to the health department. These are things that are really hurtful to our community. And we want, I guess, we want some answers as far as, you know, we can't just pour money on something and hope it works. And when you look at the numbers, and maybe Jordan can help with this, but it almost looks like, you know, we pay the 30%, and then in a year or two, you guys are in the red again because there's no cuts. You know, so.
A lot of that, Ron, in the year like 2026 to 2027, the intergovernmental funding, which would be a workforce grant, that's been about 2/3 of what's covered the employee salaries. That's a grant that there's been no discussion about being renewed, or coming back around, so that has taken the place of a lot of the, employee salaries. Without that coming back, that's where, there begins to be a loss after,
But you haven't lost it yet.
What's that?
You haven't lost it yet.
We still have the funds.
Yeah.
She uses a percentage on, of those funds every year towards, salaries and wages. And once those funds are gone.
And those are two big hunks of funds.
Yes.
Yes.
So,
again,
that's really why, things go pretty south after 2026, when that workforce grant runs out about February of 2027, so.
And our community doesn't wanna lose the health department. I think I can say that for the whole community. However, we need answers, we need transparency, I think we need a lot of things, and that's why we're here tonight, is to hear those answers.
And that's with these financials, as far as transparency, there was no budget in there for any more grants to come through. I'm not sure what that landscape looks like, I don't think we can predict that at this time, but there's no, budget in there for, added, I guess, added revenue from a DON, because we can't really budget that or see what that looks like, so it is, pretty much a baseline, having a DON with no grants. It's kind of a worst case scenario of what things would look like, especially going out to, 2029, so there is no false picture being painted, I guess.
And I would like to clarify, the 13%, that's at the health insurance line. For the health insurance, I put that I included a family plan, which we don't know what, when we hire, but the 13% increase, our health insurance increases.
Well, it's health insurance, I understand.
Yeah,
No, I
yeah, but
understand.
as far as the salary lines,
And I noticed there was $1,000 bonuses for people too. And I guess that's something we don't do if we know we're hurting.
yeah,
I mean, there's just things like that. And then there's, the community's also questioning that you guys have stored up extra supplies in different places, you know, and how big of supplies are we talking and how much are we talking? Because those are things people wanna know and they don't.
A lot of those supplies were given to us during COVID.
Right.
And so they were given to us.
And we have tried to sell
And
some.
we have given lots of stuff away to the community, churches and nursing homes and Ohio, the joint vocational medical training they do up at the by the high school. The other thing that we have to store is a program that, it's a car seat program.
And I had somebody talk to me about the car, they went up for a car seat and they were denied a car seat because nobody was available to help them.
That's right,
You don't have anybody?
we lost our person that was trained to
Yep.
install car seats.
So they left without a car seat and they were
Yeah,
very
we can't,
needed
and we
a car
can't,
seat.
we can't give car seats out unless we train them how to install them and show them how to install them. So that's the other problem too.
So how many locations do you have stuff stored?
Well, right now, we're moving everything to, if they were at just Hardin Hills, I think.
Hardin Hills and.
we've got stuff at engineers.
The engineers.
Engineers, we're moving everything from Hardin Hills to, I'm not sure what the.
Oh,
building's
it's,
called.
it used to be
On
the,
Ida Street.
Ida Street, yes.
Yes. North
Yes, the North Annex.
And we've got stuff stored at our office location.
All right.
Mary Lou?
Lynn Webb, City of Kenton. So, I'll pay off of Pleasant Township, but I'll be a little bit more unfortunately blunt. There is zero way Kenton could or would afford 30%. If we're talking $85,000, that beats our highest paid person in the entire city by $15,000. That's a tough sell when my administration took 0 raise. So those are those things that it's not against what we're doing here, it's that we're all fighting the same thing. Getting our people poached, cause we can't pay that much money, we get it, but I just gotta be very clear, the city of Kenton is a no. I know it's not a vote, but I don't have 30% to give you. And so those things, and I don't know, like, when we look at things too, and it's not to say that you don't, I just need clarification. You know, have we talked of levies? Have we talked of, you know, do we partner with somebody, another county, till we get our feet on the ground? Do we, maybe the competitors, not as in a bad competitor, but the health center or somebody who's taking that, is there that person that we can contract with just for director of nursing? I don't know, but those are the things, have we tried everything before we try to stiff 30%? Cause my budget says this is what I can pay.
From everything that I've read, it's just like a school district closes.
Right.
You get, the state comes in, decides who you're gonna be combined with. Then you pay the property tax of the people that's coming in. So if it's already higher than what we're paying, we're still gonna get the increase. So, you said, I think it was a couple years ago, you was complaining about people coming from Marysville stealing your people, and because Columbus was stealing their people. And I said, that's just the beginning, it's gonna get worse. Well, here we are getting worse.
Right.
And so, we are competing with Columbus. You just gotta give people enough incentive not to go to Marysville because it's too much more of a drive. And the county's in that predicament whether we like it or not. I've talked to many people at the Township Association. Most of your health boards are now funded by a levy. I looked up Wyandotte, because they're a smaller county than we have. They have 29,000 versus 30,000, so comparable. They have 24 employees on their health board, or but they have a 0.7 mil levy that they run.
But they don't have a federally qualified health center, and they haven't and they have outsourced their WIC program to another process, to another program. Yeah, so, I mean, it's apples to oranges again.
But it's still, it's still, we gotta change the way we do things.
Right.
And, the commissioners is the only one that can run the levy. But, you know, levy's gonna be tough. You gotta have to have all your ducks in order to sell a levy. That's 0.7 mil. The only difference is it comes out of the taxpayer instead of coming out of the inside millage. I mean, they both come out of the taxpayer.
Right.
You don't know what kind of loads you're gonna need either, so.
Yeah, we don't, you know, until
Right.
the health department has to come up with what they're gonna need.
Right.
Yeah.
Well, we have talked to other counties, actively with Logan and Union. We met with the Allen County, Health Commissioner and the Wood County Health Commissioner. So, they're in, I don't think financial situation where they could, you know, take on people either, another, from what they say to us. Logan County we asked about nursing and they said, no, they can't do that. We also asked about, what else did we ask them for, beyond? Environmental. To help with that because we're gonna need help for a few months coming up, so, and they weren't gonna, Union County or Logan County would help us with that. Yeah, well, they would. Look, Union County said they would do it for $55 an hour plus mileage. And that's more, a lot more than what we pay the person.
Okay, Joe, we got another question. Go ahead.
Chad Miller, City Council. Darryl, I kind of would push back. You said, here we are getting at a point where we're getting worse. I would argue we've been worse. She'd made reference if we would been charging 5% increments up to this 30%, we would be there. We made no attempt to have the foresight to do it in increments as a board or whoever's responsible. Now we're in fiscal emergency with the Board of Health. Where's the accountability of when we didn't have the foresight to see we needed this money 6 years ago, 10 years ago, we can't live on grants. You know the grants are gonna run out. How come we don't have that foresight to prepare for the future, and then here we are in the future and hey, I need everybody else to pay 30%. A lump sum is a lot more to stomach than 5% that we can budget for each year.
And that was one of the suggestions of the person they brought on, is to do a 5-year plan, and Dion has did that. That's how come you can see a negative and so, yes, learning from the mistakes, that's why you have a 5-year plan in front of you now.
But
So-
we are, if you have seen our carryovers in the past over the last 5 years, since COVID, they were pretty healthy, but that was COVID money, you know?
Right, but you knew that was COVID money. We all knew COVID was gonna go away.
Yeah.
We all knew that. You knew that was a bonus money for that period. Just like the solar and the wind is only 40 years. 80 years from now, we're not still gonna be collecting solar and wind. You know the window. Once that goes away, that money's not gonna be available, and it's not been planned for. And here you are trying to put it off on the municipalities and the townships for such a huge lump sum that we didn't game plan for in the process. It's just, to me, it's unacceptable. It's
But we
poor.
only allow how much carryover? The auditor only wants us to carry over how much a year?
For the general fund, it's
$135,000.
And I think there was an ask to increase that.
Yeah.
Yes, there was.
So there, I will jump with them on their side because they tried, but the others, that was not accepted.
And unfortunately, it was poor planning. I mean, with the COVID monies and how it was spent at that time,
Right.
there was no foresight on the future on what to do and hiring all these positions at that point with that COVID money. And,
That's
not
my
getting a
point, but then
return
here
on
we
those
are
positions.
asking.
Yeah.
And some of the board members weren't on this, so some of these board members are being introduced to this, and they didn't, you know.
I understand.
Right.
I'm new to
just saying,
council.
right,
I
I'm just
understand.
saying, some of these board members weren't there then, and so now they're here now, and they're trying to, you know, correct the issue, but Vaughn, did you have a question real quick?
Yes, Mayor Alger, if this 30% doesn't pass, what plan do you have, alternative plan do you have to make up for this?
Flat, we're just flat. I mean, you know, my understanding is that we are, not eligible for the, whatever, the grant money, $65,000 grant money for the DON position, and, we'll have to, I guess, I don't know how we would do that.
So you don't have a plan, correct?
Try to grow with that DON, it allows you to try to grow some revenue streams that's not available
Yep.
at this time. Apply for a few grants, but again, like we said, on the 5-year projection, we went basically as worst case scenario on there, given the balance of what it would be at the end of 2029. So that's kind of just trying to paint a honest and transparent picture for everyone on what that would look like. And go back to your question though, on the $85,000, that would include retirement and health insurance as well, not just a flat salary. So,
Yeah, that's not.
So,
Total salary.
yeah, that's not just full salary, that would be based on family benefits and retirement as well.
so in your graph where it says 2025 DON added no increase, so you're not in the hole technically until 2029.
Correct.
So what if you just did the 5% increase up until then, so you can see where you're at, what's happening, instead of asking for this big increase right off the bat, because then townships, municipalities, the city can budget accordingly to that. Because you're looking at a shortage not until 2029, so your grant situation might change, working with health partners, maybe forming some kind of other alliance with them. I don't know how that works, but to me, that makes more sense instead of just gouging everybody right off the bat for 30%, because our budget, City Kenton budget was set at the end of 2024 for this year. And like Lynn said, we gave no raises to administration. We also fund the municipal court, which people don't realize, and pay those salaries and those insurance, and we don't receive revenue from the municipal court.
I did reach out to the community health partners. So, last spring, last summer, and asked them if they would be willing to help us with nursing. And I don't even know the lady's name, what her name was.
I don't know.
She wasn't, they weren't.
They won't because of the way they're funded, or?
I don't know.
Probably
told
the
me
way
to-
they're funded.
Yeah.
Yeah, I would think, because of the federal monies that would be there.
But they are doing vaccinations for us. And I did talk to the little ones, the kids would go to the elementary school, Kenton Wildcat
Yeah.
Health, and they have not seen that many people.
Okay. So vaccinations are really kind of a thing of the past because it's all evolved to pharmacies.
Well,
You know,
pharmacies
it's-
can't give little ones back, they have to be over.
Right, but pediatricians still can, right? I mean,
Pediatricians do,
yeah.
yes.
So,
But if you remember, did you take your kids to the health department for their vaccinations? I did.
Pediatrician.
That waiting room would have been just full of
Right.
kids. But that's
and
the
it
thing
was
of
a
the
great
past.
service, but everything's kind of evolved around other vaccination
Right,
sites.
right,
I agree.
and convenience of why you're the pediatrician gets your vaccination, you don't have to make a special trip, it has changed. So, we're not saying that, we don't know that will be something we bring back. But I do know the drive-through clinics in the fall, the flu clinics for the, people to just drive up and not get out of their car, those are very well received. So.
Drew, I got a question in the back.
Yeah, Jeff Jones, Assessor, Group Township. Since we're giving honest assessments here, you have 2 people in your environmental health, actually 3, and you've given out 36 well permits and 42 sewage permits. Aren't you a little top heavy on that side? Can't you sacrifice one of those jobs to supply your RN?
Well, one of those people do all the, food inspections. One of those persons. The other one is, part-time, clerk for the environmental health. So one of them does the sewers and the water, and the other one does all the, food service inspections.
And I think those are required by the Ohio Revised Code, so we have to provide that by law.
And the nuisances, they do nuisances,
Yeah.
they do rabies,
Well, it
dog
says
bites.
here you
and
don't
that
do
kind of-
nuisances, like, number 4 on this. What nuisances do you do?
Complaints.
'Cause I called up to get help for nuisances, and I've got 0 response.
We did 3 last year.
So we help with
Yeah, all you've done
vacating,
is make recommendations, and it's a joke.
well,
I thought
It doesn't seem like you have the merit of full-time, you have 3 full-time positions in that.
The ORC doesn't say. Environmental health director is the only thing the ORC says.
Ron Rogers, Pleasant Township.
You don't need a sanitarian.
And,
Shane,
you know,
well, Shane can be the sanitarian.
It's hard to say
He also
stuff
did
because
food service.
this is our community, we love our
Well, I say
community.
Shane needs to pick his
And I think
board of bridges
he
up.
brings up an issue, for decades, we've brought up questions to the health department and we've wanted answers and we've never gotten them. We've requested certain things and we don't get them. And there were several years ago, I got a call from your department and it said, hey, would you volunteer 1 year to help us assess the community on what they think of us, basically? And you hired somebody to do that, and they had a bunch of meetings through the year, I was part of it. And I said I'd be glad to do it, but I wanna see change. Invested all kinds of time in this, they had groups, they did, things, you know, they put out, asking the community different things. And at the very end, when I finally called them, they said, well, how did it all come out? They said the board decided not to use the results. They didn't agree with them, what the community said. Nothing changed.
Are you talking about the CHIP program?
Community health assessment.
No, this was an assessment on the health department. It may have been up to 8 years ago. But it was done by a college, you hired somebody, and it was an assessment on the actual health department. And that went nowhere. I mean, nowhere. And that's 1 year with
You know what it's
that
on,
group.
I don't know. I don't know what it's on.
You guys are new.
Well, I'm not, but I don't remember.
Good.
So,
Mark Hoffman, just a concerned citizen here. What did you guys, how'd you operate before all these grants were available? Cause all I hear is you can't operate unless you get these grants that are not being renewed or so on. Have you always just operated under grant money, or was there other?
We did rely upon grant money for salaries a lot.
And because
that was
you
not
can't
right.
generate enough revenue internally to support yourselves?
I think we did. I don't know that. I mean, I think vaccine, before the federally qualified health district came in, I think we did generate enough money on, vaccines, but I'm speaking historically, this was not my era. But I think that is true, that in the past, kids got vaccines at the health department.
Well, we also have a
Anybody in business or government knows if you rely on grant money to sustain your ability to operate, you're failing. And it sounds to here like that's been going on and we've just been going with the status quo.
We have lost programs that finance nursing, women's health. We had, physician's assistant come and do women's exams and birth control pills and STD things. She retired.
As an outsider looking in, and I've been following this for a while through the commissioner minutes and newspaper articles and so on. If you can function without the grants, that's where you need to be going, gearing yourself to, and then using the grants as a bonus for fluffer when they do become available. Not the other way around, and it sounds like you guys got the cart in front of the horse.
So we had a child's clinic that our health commissioner, who was a physician at the time, he did that, and they come in and do checkups for kids. That kind of fell through when Community Health Partners started, and then they didn't show up. We have to have the physician there, and they wouldn't show up. So same way with the women's health clinic that we had. You know, we pay the physician's assistant to come, and then she'd sit there, and no one showed up for their visits that they had, scheduled. So those went away because they weren't being profitable, and we weren't really serving the community because they didn't come for them. So there's a lot of programs we've gotten away from because they weren't successful anymore. They were in the past, but not.
Okay, so you need to look at new places to bring in revenue, as opposed to relying on grants or handouts from the townships and the cities.
Right. Unfortunately, there's just no way to bring in revenue unless you add a director of nursing. So, it's okay.
so can you?
Hold on, Robert.
So, to kind of piggyback off of his question and your answer here. So, is there a way to, Frank Sellers, Jackson Township Public, is there a way to increase your services now? And nobody wants a price increase on anything, but your food service licenses, your tattoo licenses, are those fees set to you by Ohio Revised Code? Does the commissioner set those, or can you set those?
We don't set those.
No,
You
it's
can't
from the
set
state.
We are not able to set those.
We do.
All regulated from the Ohio Revised Code as far as what premiums, based on how much you generate, and how many you serve that way.
And we've
You
increased.
can't price gouge, in other words.
Right. And
They did increase this year.
Yes, we did increase ours.
Also, the same way with the birth certificates and death certificates we issued. We can't say how much we charge for those, cause the state gets a biggest
Some
percentage and we
percentage.
get a little bit, even though we do all the work.
Right, the county and the city.
How many food vendors a license have you issued out this year, not this year, but 24?
Are you talking vendors, or are you talking?
I'm talking,
Like, including like
licensed
food trucks and stuff?
Yes.
And restaurants and all that?
I don't know that.
Is that the 248 inspections?
How much?
No. You get multiple inspections, don't you, for one?
I don't know, so
Where are you seeing that?
on this environmental health number of things here. So, like, so Mr. Denson does the food inspections, right? And the Derek does, so Mr. Lutz just does the, what does he do?
He does the sanitation and water,
Yep,
he does the nuisances.
yep.
Okay, so he doesn't help the city of Canton with nuisances, I can tell you that. I've talked to him directly about that. We've sent him email after email after email of rats, abandoned houses, mold at the apartment complexes, and it just falls on deaf ears. So then you have all this in your back pocket, and like, maybe he needs to pick
Well,
up.
my comment on that is, if you don't get any luck with him. take
You
it
know
to
what
the
he
board.
told me? Call the health
Take it to the
department.
board.
Call the health department, and then when I told.
No, I mean, actually go to the board meeting.
We
right.
have.
But, I mean, that's all, if you're not
It's
gonna
falling
get
on
any.
deaf ears, sir.
Right, I know, I'm just
Oh,
saying,
okay.
but if you're not getting any satisfaction with him, go to the board, if you don't get him the
Do you know
board.
what he
then-
told me about a house that had no windows in it and kids hanging out of the windows? Lynn called, Chief Musser called, Cindy went to this house several times. Oh, I didn't get an email from them. Yeah, I did, cause I'm looking at it. So the kids are hanging out of the windows of this jagged, broken house, no windows in the house, so then you have bats and birds and whatever else flies in there. So then he just told me, call Job and Family Services. So I call Job and Family Services every day for 10 days. That's not my job. I'm on city council, but it's my job to respond to people that say to me, can you do something about this? Then you go to the proper channels and you don't get any results.
So the proper channels for the townships to get rid of condemned houses is, we take a picture, we send it to the prosecutor then gets a search warrant. So then when you bring in the health department, the sheriff's office, the fire department, the prosecuting attorney, you all get together at the same time and inspect the place. Then the prosecutor has a case. He has the fundamentals to make a case. So that's how the process is supposed to work. So I suggest that you start with your city solicitor, because he's been given that same information that the township has
And Lynn,
on how to get rid of a
And
condemned
how does it
property.
end? How does it end?
Right, here's the thing, it's not so much about abatement, cause he signs off on that. My question is when to serve the public in a health situation, whether I have rat infestation, that's him. Whether I have mold and he says can't do it cause I'm not certified, then somebody needs to get certified. Because this whole apartment complex, it's very unhealthy. And it's over and over again. Now, aside from that, because I don't wanna
Right, we don't.
beat up this.
Right, we don't beat these guys, right.
But what we all need to start paying attention to is this is rural America and we're getting hammered. Because their hands are cuffed on a lot of things.
Correct.
And we find out, and I'm sure you guys all find out, you gotta just keep paying all these fees for all kinds of things we don't have any say over. They are squeezing us rural America to where we don't have, where we have to dissolve and then we have to go to somebody else. So,
Right.
however, we have to come together
Yeah,
to
we
get
need-
this
we need these
done,
people.
but we can't just keep putting a Band-Aid on and say, let's throw some money at this and hope
Right.
that it comes together. I mean, have we talked about a possible levy? Is that a possibility?
We've talked
See,
about
yeah.
it.
Is it just because we think it won't fly?
What?
Go, Randy, go ahead.
Okay, and this was something that I was considering. You hit the nail on the head with the levy. I would much rather see one levy from the health board because of the burden that it's gonna put on some of these townships. Why not have one levy specific for it, sponsored by you guys, rather than to have 5 or 6 townships have to run levies of their own because the burden this 30% will put on them.
Right.
The commissioners
Plain and
will
simple.
run the
Yeah,
levy.
It has
We would
to
have
be
to-
initiated though,
It has to
guys.
be-
Someone's gotta initiate.
It has to
Let
start
me say
somewhere.
something.
Right.
And guys, Tim, Joe, correct me if I'm wrong, but generally speaking, when you look at a levy, you're looking at, for the commissioners to look at, a countywide levy. I'm not talking about just a specific levy for a town or a community, but we're talking a countywide levy. That's the ones that come to the commissioners. And those levies are brought to the commissioners by the ones initiating the project. So, for example, the Board of Health would initiate a project saying, we'd like to go and have a levy assessed, and that would take the place of the subcommittees here.
Right.
Instead of this money, we do it through the levy. They would check with the auditor to see what the millage rate would work out to be, and then they would come and propose a county-wide levy to the commissioners. And then it'd be up to the commissioners to either approve it to go on the ballot or not approve it to go on the ballot.
But they have to initiate. The board has to initiate it to you.
The
To
board
commission.
would have to
Right.
initiate it to the commissioners.
And I think we're probably headed in that direction, unfortunately. You know, I mean, go ahead.
I don't know.
Brad Hayes from Liberty Township, and when you mentioned about the process of going to the prosecutor for getting rid of nuisance, getting rid of homes that aren't up to health standards and stuff, we have not had very many of those in our township, but it does work. And it is very much where you have to follow the procedures, but between the county prosecutor and the paralegal that is currently there, they do a very, very thorough job, and it's a very safe process as far as when you get the warrants, there is always a deputy sheriff that's there. And people's emotions are very high at that point in time, which everybody can understand, because nobody would want someone coming into your house and say, whatever the problem is, you gotta fix it, or you're gonna be out. And so the process for us does work, and it takes time, but they're very thorough, and they're thorough on the follow-up, and that process will work. With the health department gets involved, but you said there's about 5 or 6 entities maybe that are there, and that goes if you have a local, you have the county engineer, you have a local fire chief, they're there, and then you take it from the county engineer, the health department, and the process will work. At least it works for us. And in a timely manner, but the timely manner takes an extended period of time.
Nothing works as fast as we want. Right?
Yeah.
So, good.
Just a quick question for some clarification. It looks like the county commissioners, have been very, supportive of the health for quite a few years. And I'm not sure, has that become a line item, revenue item? Or is that still looked at as a?
That was a one-time.
So does the county, okay, so I gotta get something on my, obviously, the health department is a very important part of the community, and it's a service to the community. And we've talked about revenue streams, we talked about expenses and things like that. We have some things over in the village, like a swimming pool, that's not gonna support itself, so it has to be subsidized somehow to be like that. Is the intent, and how our other county health departments, are they run where they cash flow themselves? And I'm not talking grants, I'm just talking about money from, we're doing townships, we're doing villages, we're doing cities. The county, are they part of the revenue stream? does the county commissioners need to budget money out of the county general fund to go to this to help subside it?
Not to
This is
my
the first time we've ever got money from the county commission.
Yeah.
And it was a big bunch, I'm not
It
saying anything
was.
like that,
So-
it was a big bunch.
Roger.
I did print off Wyandotte County's fiscal report, anybody wants to look at it. Also did, Logan County. You guys see all the programs they do in Logan County. And so the programs help support the program, and losing people didn't help you get grants, so it was a perpetual motion type of thing that caused this train wreck. And
I don't know, growing and being bigger, everything goes up in proportion, expenses and overhead and all that type of stuff. So adding programs doesn't necessarily mean that you're gonna generate a profit. I'm just saying, as a whole, is the health departments and counties self-funding? Or
Doesn't
do
Wyandotte
they?
have a grant?
They have,
No,
they have a levy.
Wyandotte has a levy.
they have .7 mil
Plus they
levy.
get subsidies too.
Yes.
Yes.
The whole thing has to work together. You have to have people to get grants, and if you don't have people, you don't get grants. So
Throw the grants out, and they can say that we're gonna support this by ourselves. Are we thinking that and we know that the programs aren't gonna be the answer, so we're looking at trying to generate more, revenue. Does the county, Fred, I'm kind of maybe putting you on the spot here. So what happens is Kenton, if you look at the percentage of what people are gonna go up that 30% to Kenton, means, about 3 times what it does to Ada.
Right.
And all that type of stuff. So the people that are generating the most money are getting hit the hardest.
Right.
And, I don't know, I guess I'm just looking at that revenue thing.
Okay.
So something I think that needs to be emphasized is Wyandotte County, yes, they are similar in our size, but they have a customer base that we don't have anymore, right? So if you're saying, you're hiring a DON to go out and do programs to generate revenue, that revenue is not there. There are no customers to go get this from. And so that's a big difference. So I don't think Wyandotte is something that we can look at as a comparison. And, per the ORC, you can get a sanitarium and health director in one, but they're really at your base. I mean, you have the DON, the commissioner, medical director, and the environmental health. I mean, and I think you have to have a clerk. You have to have a clerk.
Well, you have to have
A
your
registrar.
statistics.
Yeah. So, I mean, you're almost down to bare bones of what they have right now.
Right. Bare bones.
And we don't have a customer base to support the bare bones that we do have. So the question to the board for me is, have you talked to the state? Have you been in conversations with ODH to say, we are in a situation that even if we fund the people that we have at the very minimum, we don't actually have the workload for them to actually do the services in our community because they've been outsourced.
We have.
And what did they say?
Yeah, you talked to them.
Yeah. They, when I have talked to them, they tell us, to see what we can cut and what programs we can add and, what grants we can go for.
ODH is not particularly helpful, for what we need.
And they have had us talk with the OHC,
What is that?
Association of Ohio Health Commissioners.
Oh, yeah.
Okay, question to that?
I don't have a question, I
Don't
just
comment?
comment, I think we're kind of stuck in the mud here. Like, I can't see the justification for the 30% as a township official. So I think you need to open this up and look at it more and be more transparent about things. Like, I don't think you're quite answering all the questions everybody has, so, like, we can do this all night. Can we start moving along here?
Yeah, we're gonna move on here, okay.
I do got one question, we're gonna back up here a little bit. You guys were talking about your tuberculosis cases, and a couple of those were inherited from other counties. I'm gonna relate this to the situation that BKP was in. You know, BKP provides services to, you know, contracted services and so on, and we're covering other entities. You know, there's gotta be a way that you can recoup some of that cost, so how, if we inherited these from other counties, how are we paying for it and they're not? I mean, can't you go after
Because
them?
they moved back to Hardin County.
Yeah, they've
They
moved
reside
here
in Hardin County.
from outside the county, and so we inherit the case, and
Wherever
we
they're
have to-
currently living.
Yeah.
Now, if they move back, we wouldn't have to worry about it, but if they reside in our county, then we are responsible for that.
Well, and I guess I didn't understand that, the way it made it sound, that we inherited them, you know, you make it sound like it's being passed off from another county.
No, they
I
moved
understand if
here.
they're a resident, okay, you're kind of
Right,
fine.
they acquired it somewhere else, but they moved here to live.
Fair enough, just a question.
Yeah.
So at this point, go ahead.
Just a quick comment, so that we can keep this moving.
Right.
I think I'm speaking for myself. We're not, personally, I'm not in favor of the 30% either. What is the proper way for us to get this information relayed to the prosecuting? You say the prosecutor, the auditor, and who's the third one?
Treasurer.
Okay.
Right.
So this, I guess at this point, those are the people that we need to let know.
So what I think we let it go to them. We let it go.
Wait, you're gonna let what go?
Well,
Something that we don't agree with?
Well, no, I mean, so, we're gonna agree on a figure, or are we just going to?
Well, we don't agree with this at
Right,
all.
no, I
So
know,
why would
I
this
know,
go to them,
so,
Kevin?
huh?
Why would this go to them if none of us agree on it?
Well,
You really don't have a choice. right?
yeah, unless you're gonna.
Oh, so we don't have a choice?
No,
You don't.
Oh, so
Not
what are
according
we
to
here
the
for?
revised code, you don't.
What we come here for then if we don't have a choice?
You offer the suggestions, and the board is hearing your suggestions.
Yeah, I came to hear some accountability, and I haven't heard anybody be accountable for anything,
Well, wait,
and I still don't.
Right.
you say we don't have a choice?
No, I
understand he's in the room, but if we don't have we do have a choice, and I asked that earlier, what is your plan if this goes down? But it didn't sound like you had a plan when you came in here. 30%'s a lot, and that's gonna hurt my little village. That's a lot of money, and some of the other villages here in Hardin County. But you knew that was a lot, and you knew that may go down, but you still don't have a plan in case it goes down. And I've heard a couple of suggestions on what to do about it, but are we voting tonight on the 30%, or what are we doing?
My opinion, I would let it go back to the board, and the board needs to review it and get with the commissioners.
No, the budget committee.
The budget commission, get
Right.
with the budget commission, and then let them review all that, and I think they need to take it to the
That
commissioners.
sounds like.
Would you support a 5%?
I'm not upset.
Yeah, right, okay.
Yeah, I think we just,
You just don't have a business plan moving forward.
right?
You don't have
Right,
a.
yeah,
it's
right,
just-
right.
It's tough to
We're taking a
put
shot.
money
It
into
is.
something without knowing what the vision is. I
Right,
think we
right.
all get behind it.
There is no vision when we don't have a vision.
We have a vision, we know what we would like it to be.
But it's not
But-
today.
But we don't know how it will work
Right.
with the budget that we have now.
Right.
You know what I'm saying?
Can I ask real quick, so you said you guys need a Don to be able to pursue grants and things, isn't that kinda recycling the issue that you've ran into? I mean, that.
It's not a
I mean, if you're needing a Don, if you need us to pay for a Don for you, so that you're able to pursue grant money, that is just doing what has got you where you're at now.
That's
It's-
an eligibility grant. So the emergency preparedness grant that she would make us eligible for, or he or she, whoever, would be
My point is, you're gonna try and live off of grants, continue to live off of grants.
You can't keep doing that, so.
I mean, that's what you're telling us, you need a Don to continue to
But
try and get
besides
grants.
that, the Ohio Revised Code says you have to have a health commissioner or administrator.
Correct.
A full-time sanitarian and a full-time director of nurses.
I understand that, but you're not offering a business plan beyond what has not worked for you.
What happens if
You're trying to live off of grants, you're telling us you need to get them grants with the
No,
Don.
we're asking for money, so.
To pay for that, Don, to be able to
Correct.
pursue grants again.
Without that DON, not having that per the Ohio Revised Code, it opens up ODH to have another county come in and absorb
Right.
this health department.
Okay.
That's historically not happened, though.
And once that happens, then.
It hasn't. No county has joined with another county and.
Yeah, they have.
In a
Yeah.
district, a combined district,
Blake,
a county.
yes.
Blake
Let's
County
not
is
get carried,
the
let's not
other
get carried away on all this, so, I mean, we can beat this all night, it's not, you know.
Right.
Well, I have.
So I just think,
I have one more thing. So, as far as this being an advisory committee, and you guys can do suggestions, you know, to the board, and the board they have time before the budget commission to make changes for what they're asking, so that would be a good idea. But is there a way or a method to say some of this advisory, oversight to come and be a little bit more present in the board, so that, because I've heard them say, well, we wanna know what the townships want, we wanna know what they want. And so they're looking to you guys for information, and you're looking for them for information, so.
I think Daryl goes to meetings.
Daryl goes to all the meetings,
He's
plus
in the
they
township,
get
so.
all the minutes from the board
We
meetings.
go, hold on, question in the
Well,
back.
I'm just trying to say that maybe this
Hold on,
needs to be
wait
a
one second,
continuum.
guys. We're gonna
I'd
get
like
to
to
that.
help you understand the role of the advisory board, because
Right.
it sounds like the biggest sham job I ever heard of, if they're just gonna go up there and ask for it because they need it, regardless of what we say.
We're all the advisory board, all of us are, so.
What's the role of the advisory board if we don't have a say?
I still say we have a say, but.
You
They're
appoint,
saying we don't have a say.
Well, I'm just telling you what the revised code said, you make
So what's the
recommendations
role of the
No,
advisory
to
okay.
the board, and you make your recommendations.
no, the advisory board appoints your health board.
Right.
You guys, your appointment, you guys can make policies. There's some other things. There are things that you can, the advisory board can make policies.
No, we make recommendations, we appoint the health, the
Okay.
board members.
So it's up to them to do whatever with our recommendations. Are we making a recommendation tonight then?
No?
Yes, you guys, I mean, you
But
guys.
nobody's heard it.
That's what you guys are here for, you guys are, you know. You guys are here to make a recommendation. I mean,
Does
so if you
somebody
guys
write it up?
recommend, go ahead,
I'll make one.
okay.
I'd recommend you go back and review your budget, and like the gentleman said at the beginning, look at your budget, there's some cuts, I'm sure that can be made, and if there isn't, come back and show, and then come back, not with 30%, but come back with something that that Hardin County can live with. And if you have to, then go for a levy, but I'm not for a levy, I'll tell you that up front.
So that's your recommendation? That's fine.
That's what I would recommend you guys to do.
Anything else? Cause if not, we're gonna beat this to death and we're not gonna get anywhere, so.
And you would add business plan along with that probably?
Vaughn, he's talking.
You would add a business plan along with your recommendation?
I would recommend that.
Yeah,
yes.
okay.
If you don't have a plan, these guys can tell you, the commissioners, if you don't have a plan, you ain't getting any money.
Every
If you don't
time,
have a plan for these people that's voting, you ain't gonna get any money.
every time. And it's a good standard the commissioners put in place. Come to us with a plan and we'll talk about it, correct?
That's right.
And, you know, it always seems to, whether we like it or not, but I think that's the main thing is there has to be a plan and maybe some sort of performance audit within.
So the recommendation is that they go back and then
Review it.
and come back
Together
with a plan.
plan, review your budget,
Okay,
30% ain't gonna fly.
okay.
You can read that.
That's what you need, recommendation on that, so.
But then would you come back to the DAC? Would you call another meeting of the DAC of what their change is?
The health commissioner and the
Yeah.
chairman can cause it.
Yeah, we can call.
Call another before it goes to the budget commission.
We can call them.
So I guess we beat that enough that we know they're gonna come back with a plan.
But it has to be to the auditor by
Right.
the 1st of April.
Right, so it's gonna have to be
Quick.
quick, so.
Couple weeks, whatever.
Is that when
Yeah,
the,
focus on
the
that.
budget commission is prior to April first?
Do what?
The budget commission is prior to April first?
No, it's after.
After. So.
The auditor has to do his calculations, he presents that to the budget commission, and then they vote yea or nay.
So that's the other thing, cause we're all have our budget.
Right, right.
And then you guys are this far, so how do we know what to budget?
Well, this is for 26.
Yeah.
This is coming out in March, the money, the 10%, the 30% would be starting March 26,
Yeah.
in 26.
Yeah, you wouldn't start till 26, so. So I got the plan is they're gonna go back, come up with a plan, and then we'll call another meeting and go from there. Is everybody okay with that? I mean, if not, we can beat this all night, we're not gonna get anywhere, so. So with that, then, do we have any, anything here?
We do, recognizing our employee of the year in the health department. This person has stuck with us through thick and thin, for going on 9 years. We appreciate her. She's filled the job as registrar for us for the last few years. And we have nominated Jennifer Newland for our employee of the year.
Good choice.
Any, old business? No, we already passed on. Any new business? So then we'll go back, you guys will go back with the plan. Then we'll call another meeting. And hope we can get something. So right now, the next meeting is next year, so we'll be another one.
That sounds good.
Hopefully before that, so. But right now, the next meeting, the next regular meeting is March 11th of 2026, but we'll get with them and we'll have to get something going pretty fast, so. If not, then, any other questions or comments? If not, meeting adjourned, thank you.